Welcome back to Face the State. I'm Ariana Bennett. Thank you for keeping it here. I am back with Dr. Tomlinson and Dr. Whittier from Northern Nevada Hopes talking about some of the big issues facing healthcare in our community. Thank you again to you both for taking the time to come on the show, talk about these important things. The last segment we were talking about the Department of Addiction Medicine and kind of how that works. And I understand you're already, doing a bunch with it, hoping to do even more down the road, right?
I think our goal is increasing access for patients. And so what that has looked like is medical providers at 2 different locations in town, behavioral health therapists offering individual therapy, group therapy, peer support specialists, case managers, fully functioned staff teams at 2 different locations so that we can increase the amount of patients that we see and the times that we're seeing patients and overall the access to this life-saving treatment.
And you made a really interesting point when we were in break, which is people should seek care even if they're not ready to go cold turkey, no more of whatever they're addicted to, right?
I think historically, treatment has really been centered around abstinence, complete abstinence from drugs, and that has been a big barrier for patients actually seeking care. Many of the patients that I see, actually, that's really intimidating for them to come to me and say, I'm done with this. People have valid reasons for use, and that might sound shocking, but I think that it's really important to kind of consider that and understand that treatment exists on a spectrum and that abstinence is not the only treatment outcome. There's a lot that we can do for the health of our patients within the walls of Hopes and in clinic to improve their health, and that includes vaccination, prevention of HIV, general preventative medical care, cancer screenings. And so if we can get patients in the building, engage them in their health, help them understand what options they have and how they might fit into their life and really start a conversation and a relationship, then we're affecting health outcomes regardless of whether patients are using drugs or not.
So some treatment always better than no treatment.
Absolutely. And I think one of the things that we want our patients to know is that we are partners with them. If we can get patients to continue into care, we can work with those patients on the barriers that they are having in their lives. What are those things that we can help them with that might be contributing to them continuing to use? Do they need behavioral health? Are they having food insecurities? Are they having domestic violence? All of those things that could be contributing to a patient that is continuing to use. We believe at Hopes, with all the wraparound services that we have, we can really get down to very specific things and very specific resources that we can individualize for patients. So I think, again, the main thing is to keep those patients connected, and especially when we talk about our maternity patients, no prenatal care is probably the worst thing. So having them connected to care and for them to understand we are partnering with them, I think is one of the most important things.
You guys do so much great work at Hopes, and I know you have a lot of Medicaid patients. You do get federal funding for what you do. How are you going to be affected by the changes in federal funding, the cuts to Medicaid, that whole environment? How is it impacting Hopes and its programs?
Yeah, it will negatively impact our patients. Unfortunately, a lot of our patients will lose their Medicaid, they will lose their coverage, they will lose their benefits. We at Hopes are here to see patients, and so we will obviously do our best to try to help those patients find the resources and coverage and how we can help them, but we understand that this is going to be a huge, huge problem.
Anything you wanted to add about that?
Yeah, I think it's really disheartening. I think we have a lot of good news and a lot of great goals for expansion, but I do think that we're kind of at a crossroads in terms of helping patients access care, and insurance is a big part of that. And Hopes' mission since the beginning, as you mentioned, is really to find the groups that have gaps in their care and have difficulty accessing care. And we do that for many different populations. Those who are experiencing addiction is one of them. Cutting access to payment for that care will certainly affect our ability to treat people and get people in the door.
Yeah, and one of your big defining things is that you don't turn anybody away. You have a sliding scale for people who don't have insurance.
Absolutely.
To help them pay for the care. So they should still seek you out, even with all that. Any other message for people out there who are, maybe haven't seen a doctor in a while?
Come on in.
Come to Hopes.
I think that we're trying to lower barriers all the time to getting patients in the door, and especially patients who feel nervous to come into a healthcare setting. It's a vulnerable place to be. If you are struggling with addiction or someone you know is, you can literally walk in our door and speak to somebody on our team who can help you sort of navigate how to get into care. And I think that is really powerful. I hope we have shown our friendly faces and made people feel comfortable to at least take that step.
Yeah, well, a lot of people have been taking you up on it. You've had more patients coming in the doors every year, it seems like.
Yeah, we continue to grow, and at Hopes, we hope that the community knows that we are here to meet them and their needs where they are.
Okay, well, we have a couple minutes left. For people who are watching this who really love your mission and want to help you, what can the community do to help you out?
Come in and get care. I think that's the main message. We're here. We offer all kinds of services: preventative services, chronic care, pediatrics, maternity. We want patients to come and get their routine care. That's
and
what
if you
we
have
want.
insurance, that is helpful, right?
Yes,
To the cause?
we welcome all. We welcome all.
Okay. Donations? If people want to donate?
Absolutely,
Always,
donations,
always,
please.
We rely on a lot of grant funding donations to provide services that we have for patients who don't have the money to pay for them. So I think if we are all kind of collectively looking out for those who are most marginalized in our community, it elevates the health of our community, the standards of care in our community at large.
Absolutely.
All right, we have just about a minute and a half left. Any final message about what makes Hopes different? Why to maybe seek Hopes out rather than, the other options that are out there?
I think one of again, and I don't want to keep laboring this message, but I think we pride ourselves on meeting patients exactly where they are. We are welcoming, we are inviting, we are non-judgmental. I feel like we are a warm, safe place for patients to come and get care.
I agree. I think that, with creating this Department of Addiction Medicine, with starting prenatal services, again, we're trying to fill these gaps and partner with others in our community. And I think it's a really exciting place to be. It's supportive. It's building programs that others can replicate and look to, and elevate our health and our community's health as a whole.
Okay. Well, thank you both for your time. I sure appreciate it.
Thank you.
Thank you.
Appreciate it.
Well, that is it for this episode of Face the State. But for more information or to see past episodes, you can head to our website. That's 2news.com. Thank you so much for being with us. We'll see you next week.